Hi everyone, thanks for listening in to Black Mental Health Matters. On today's show, I'm going to be talking about ADHD, how to recognize it, what the most common treatment is, and why it's relevant for the Black community. So, if you're interested in learning a little bit more about ADHD, then keep listening. Hello everyone, and welcome back to Black Mental Health Matters. I'm drkerryann Williams. I'm a psychiatrist practicing here in Massachusetts. And this is a talk show that's about all things related to mental wellness in the Black community. So if you have any questions or comments throughout the show, just give us a call at 617-238-7111. That's 617-238-7111. We're also streaming live on Facebook, and the Facebook page is heat981fm.com. That's heat981fm.com on Facebook. And guys, today I am back in the studio, and I'm going to be talking to you about ADHD in children. ADHD. This is a topic that just never gets old. It's something that, as a psychiatrist, I treat all the time. Some of our children in our community have it, but they're not diagnosed. And some of our kids don't have it, and yet they still receive a diagnosis of it. So is it overdiagnosed or is it underdiagnosed in our children? So today I'm going to talk a little bit about that. I'm going to tell you about what ADHD is, how you can recognize it, what the most common treatment is for it, and why it's important for us to talk about ADHD in children in our community. So ADHD is attention deficit hyperactivity disorder, right? Attention deficit hyperactivity disorder. I think it used to be called ADD, attention deficit disorder. They just called it one big thing. And then they said there's 3 different types. Okay, there's an inattentive type, there's the hyperactive type, and there's a combined type. Now, in order to actually get a diagnosis of ADHD, you have to have the signs and the symptoms before age 12. Okay, it used to be a little bit younger. It used to be the cutoff used to be age 7, but then we realized that sometimes it gets missed, and so the cutoff is age 12 now. So what that means is that if you're an adult and you're trying to get a diagnosis of ADHD, sometimes the doctors are hesitant to give you a diagnosis of ADHD if you're coming as an adult. Right now, sometimes people get the diagnosis for the first time in adulthood, so that does happen, but they're going to ask you a lot of questions. Sometimes there are some people that they don't really even diagnose or treat ADHD in adults, but others that have a little bit more training, what they'll do is they'll ask you a lot of questions. And probably what they might ask you even to do is to provide some records. So they want to know what happened in your childhood. Because remember, you have to be, you have to have the signs and symptoms before age 12. So they're going to ask you questions about what your childhood was like. What was your school performance like? Did you struggle in school? Because if you just kind of sailed through school, there was no signs and symptoms of ADHD in your childhood, then it's less likely that it's a true ADHD. So they might ask you for records. In fact, sometimes they even as an adult, they might ask to speak to your parents because they want to know straight from your parents, did you struggle in school? Did you have these signs and symptoms that I'm going to talk about? So there's a lot of things that can make it a bit more difficult to get the diagnosis as an adult. You can get it, but you have to show proof. You have to show some kind of written documentation or proof from your childhood. You can't just show up and say, I can't focus, and then get prescribed ADHD medication. So as I said, starts before age 12. There is the type where it's just inattentive, what they used to call ADD, that's inattentive ADHD. And then there's a type that's where kids are just more hyperactive and impulsive. And then there's a combined type where they're both inattentive and they're also hyperactive and impulsive. And as you might imagine, the kids that are more quiet, the ones that are just inattentive, they can fly under the radar. And that's part of the reason why the age got raised from age 7 to 12, because some of the kids that are inattentive, they fly under the radar. Sometimes they can overcompensate because they're very smart. They have high intelligence. And so they get missed because they can, be disorganized, but still finish all their schoolwork, still get good grades. And no one notices that they're actually very inattentive. That can happen. And that's part of the reason why there's sometimes a late diagnosis. So you may have someone that gets through elementary school, maybe they even get through middle school, then when they get to high school, they struggle. Or sometimes they get through all of that, and then when they get to college, it's the first time they're really struggling because suddenly they have to keep track of so many things. So the other thing that happens too is when kids are quiet and inattentive, sometimes parents think they're just being lazy. They don't realize that there's an ADHD problem, that there's an inattention problem. They think, oh, this kid is just being lazy. And it's not until their grades start to decline and teachers start to comment and people kind of work at getting a proper diagnosis that we figure out, hey, this is what's going on. So if you have a child that has ADHD, if you have questions about ADHD, you can give me a call at 617-238-7111. That's 617-238-7111. And I can answer any question you have about ADHD. But I'm going to start with this. Are you one of the people that questions whether ADHD is even a real thing? There's a lot of people that kind of question whether ADHD really exists. I know sometimes people may come to the US from other countries and they think ADHD is kind of like an American thing. And they'll say, oh, ADHD didn't exist back in my country. And then there are other people that say, hey, this isn't really ADHD. It's this child, like the parent just needs to get them in line. They just need to be a better parent, get them in line, get them to follow directions. Or again, I said, they might just say their child is lazy. If they would just work harder, if they would just do what they need to do, then they would be fine. It's not ADHD. The other thing that we look for is whether you just have an active child. Sometimes it's not ADHD. Sometimes your child is just very active, and that's just how they are. They just are very high energy, but they can settle when the situation calls for it. So, as you might imagine, of course, ADHD is not just an American thing. It is it's a biological thing, right? So it can exist in other places. The difference is that in countries like America, we routinely diagnose it and treat it. We routinely assess for it. So when you bring your child to the pediatrician, they're going to routinely assess for ADHD. I can't vouch for what happens in other places, but in America, we do test for that very regularly because it's such a simple and treatable issue that affects children and affects their education, affects them academically, affects them socially. It's something that if it's missed, it can really, really affect a child's self-confidence and affect their ability to reach their full potential. So ADHD has nothing to do with bad parenting, okay? Now, of course, if you've given up and you're not doing anything at all, then that's gonna be a problem, but it doesn't cause ADHD, right? ADHD is biological. There's some science going on. There's some science kind of behind what's going on with the child. So there's a term that we use in psychiatry and in the medical field to describe what ADHD is, and we call it a neurodevelopmental diagnosis. So neuro for the brain and then development because it's kind of starting in childhood. So we know that neurodevelopmental means it's long-term. This is not something that just happened because something bad happened to you. It's that from the time that your child is born, your brain is, their brain is developing and different parts of the brain grow at different rates. And the back parts of the brain develop first, and the front sections of the brain kind of develop last. And the parts of the brain that you might imagine that are involved with ADHD are in that part of the brain that fully develops last. But, that part of the brain, we call it the PFC, the prefrontal cortex. It's responsible for everything related to attention, everything related to impulse control. It's responsible for managing your impulses, understanding cause and effect. So for example, that if you have a child and they should be able to recognize, hey, if I steal this money, I'm gonna get caught. Kids that are impulsive will do the same thing over and over, get the same consequence over and over. And it seems like, why can't they learn from their behaviors? And it's because of impulses, because that part of the brain that kind of teaches them cause and effect, it's a little bit weaker. It's a little bit underdeveloped. Okay, things like problem solving, how to solve problems using words, how to figure something out besides just using behavior or trying to hide things, right? Again, thinking if I do this, this is going to happen, kind of being able to do planning, that part of the brain is responsible for that. And perspective taking. So all of these very, very important things that are necessary socially, academically, that is kind of part of the last part of the brain to finish developing. So we expect normally that kids at very young ages are going to be bad at all of these things naturally. That's just how it is at young ages. We expect small children to have problems paying attention. We expect small children to have trouble managing their impulses and to have problems with perspective taking and solving problems. We expect small children to have that issue. But as they get older, they should be improving in these areas. Even though they might still require a lot of guidance, they're improving in those areas over time. And school is a major way that children improve in these areas. So we actually use school performance a lot. We use school behavior to assess and make the diagnosis. The other way, if you're wondering if your child has ADHD, the other way to kind of assess for ADHD is you can have them do a full psychological assessment. There's two types. There's a neuropsychological assessment and the full kind of psychological assessment. And that one is thorough, it's comprehensive, it's done by a licensed psychologist, a PhD psychologist or a PsyD psychologist, and they will do kind of like a whole battery of tests, and their child will be there for hours. Sometimes they even split it into more than one day depending on the situation, and they do a lot of different tests, and at the end of it they'll figure out, okay, this most likely indicates ADHD. So it's a very thorough assessment. The only thing is, of course, like anything that's good and thorough and very helpful, insurance doesn't always cover it. So it's a assessment that can cost a few $1,000s if you want to pay for it out of pocket. You'd have to go to a psychologist that does neuropsych testing or psychological testing. But the key is here, insurance doesn't cover it if the purpose of the test is listed as ADHD, because they're going to say, oh, ADHD is a clinical diagnosis, you don't need to do a psychological test for it. So they're not going to cover it. But if the purpose of the psychological test is something else, and you happen to just, they add on the ADHD testing to it, you might get it covered if the purpose of the test is listed for some other thing that is. So, if you talk to the person assessing you and you list the reason for the assessment as being something else that is covered by insurance, the psychologist can add on the test for ADHD. A little bit of a loophole, but maybe insurance will cover it that way and you can still get the full psychological assessment. So if you're looking for an assessment for your child for ADHD, you might want to get the full psychological assessment, but you don't have to do that. Your pediatrician can diagnose it, the psychiatrist can diagnose it, and in particular, child psychiatrist is, again, this is kind of our bread and butter. This is something that we assess for and treat all the time, so we're really good at doing it. So again, thinking about how to recognize if your child might have ADHD, let's go back to school performance, because for small children, you may start hearing reports from the teacher, okay? So they'll say little things like, well, all the other children are sitting down and yours keeps getting up. Or they'll say, well, all the other children are able to settle in this way. Your child keeps talking, even when they're not supposed to be talking. Your child has a harder time waiting their turn. That your child they're cutting in on other children. They're blurting out the answers in class. Those are all things that kind of indicate impulse control problems. They can't sit still. They can't stop talking. They can't wait their turn. Now, here's the thing. This does not automatically mean that your child has ADHD, but these are some of the features of ADHD, okay? Sometimes your child is a little bit immature. They just need to catch up. So sometimes it's just a teacher. Sometimes it really is just a teacher. Like they need to just be patient with them. Nothing's wrong. There's no ADHD. They just need a little bit of time to mature. And sometimes it is true ADHD. Sometimes it really is ADHD. Sometimes it's a learning problem. So what's going on is they're having a problem with reading or they're having a problem with math, and the work is just too difficult for them and they don't want to do it. And so they get really restless. They start distracting the other kids. Okay. Sometimes it's actually the opposite. If there's no learning problem, but what's going on is that the work is too easy and they finish it very quickly and then they get bored. And when they get bored, they start getting restless. They start distracting everybody else. People think they have ADHD, but it's really that the work isn't challenging enough for them. So that can happen too. So sometimes it's actually that you need to actually keep them a bit busier, give them higher level work, and they will be settled. Sometimes it's something as simple as that they need glasses. Maybe they can't see properly, and so they kind of seem like they're not paying attention, they're restless and so on, and they actually need an eye exam or even a hearing exam or something like that. So before we give children these kinds of diagnoses, they're always supposed to have medical assessment from the pediatrician, check their hearing, check their vision, With the learning disorder part of it, that's the other reason why it's helpful to have a psychological assessment, is because a psychological assessment will also check for learning disorders. So with the school, sometimes if there are behavioral problems in the classroom, you can have a written request for accommodations, and you can also request testing. So the school can provide some amount of that kind of psychological testing. It's not as thorough as if you were to get the psychological testing from someone in private practice out in the community, or to get it on your own. That would be a lot more thorough. The one that the school does as part of the school district, they're primarily only checking for the academic problem. So if you suspect that there's a learning problem, you can get that testing done through the school. They're required to provide that testing if it's needed. So they can check for things like a math disability, reading disability, writing disability, that kind of thing. The school, if you put it in writing and request it in writing, request testing, the school should be able to provide that kind of testing. It's just the ADHD testing that the school does not automatically provide. And the psychologist can provide it, but insurance doesn't cover it, So you have to kind of find ways to trick the system a little bit to get what you need. But yeah, for learning problems, put in a writing, the school district should be able to pay for that for you. So, sometimes children are having trouble paying attention, and the reason is not ADHD, it is because they have some other stress going on in their life. So if their child is having stress at home or in the community in some other way, then of course when they go to school, they're not going to be able to focus. They're preoccupied. So they're going to seem like they're not paying attention. In fact, if they're feeling stressed or anxious, they might be restless. They might even have behavior problems. And it's not ADHD, it is stress in some other form, some kind of adversity. So that's part of the reason why having a proper assessment is helpful. So I said the pediatrician can do a preliminary assessment, but they often will, if they start a medication for ADHD or something like that, they want you to have a referral to a child psychiatrist who can do a more comprehensive assessment. The child psychiatrist is going to rule out some of these things, like, is it actually trauma? Is it, something else? So the pediatrician can rule out the vision problems, the hearing problems, some of these other things. The school, through assessment, can rule out learning disorder, and the child psychiatrist will do that comprehensive assessment where they can look for things like trauma and adversity and stress. So yeah, I sometimes find where I'm assessing even a teenager, right? And the teenager comes to me, they're already on an ADHD medication. They've been on an ADHD medication since childhood. And they come to me as a child psychiatrist. And when I assess them, I realize they never needed this ADHD medication. I take them off of it and they're fine. And what happened was that when they were young, somebody assessed them, put them on an ADHD medication thinking that, okay, well, they can't pay attention and they're restless. But really what was happening was there was trauma or adversity or something else. And that's what needed to be addressed. So that happens all the time. Sometimes I stop the medication, there is no change. Sometimes there's even improvement when I stop the medication. So it's important that, the first step is to have the right diagnosis, right? And it's also part of the reason why I always say it's really important to be honest when you bring your child in for an assessment, right? Because as a specialist, I can only treat based on the information I have. So if I don't know that there's some kind of stress or adversity going on at home, I might diagnose your child with ADHD because I don't know that there's something else happening. So if you're not honest, your child may end up with a wrong diagnosis and a wrong medication. So it's really important to be honest about any stress or adversity the child is experiencing at home to avoid wrong diagnosis and wrong medications. Okay, so as I said, guys, our show is on Facebook Live. If you want to drop a comment, go to heat981fm.com. That's heat981fm.com. That's the Facebook page. Drop me a line. Welcome to those that have already joined me on Facebook Live. Today I'm talking about ADHD. I'm Dr. Carryann Williams. This is Black Mental Health Matters. And I want to hear from you. Do you have a child that has ADHD? Do you feel like they have the right diagnosis? Do you feel like they've gotten the right treatment? Do you feel like the school did a good job in helping you identify that they were having problems? Did you have a hard time getting the right assessments? I'm curious to hear your experiences in our community, because I think, again, there's this question: is it overdiagnosed or is it underdiagnosed in our community? Sometimes kids get the diagnosis, but they don't really have it. Sometimes they don't get the diagnosis. But here's the truth: just like most other mental health issues, ADHD has historically been underdiagnosed in Black and brown people. ADHD symptoms occur at the same rate in Black, brown, and white people. Okay, ADHD, the symptoms themselves occur at the exact same rate in all the people. However, white and English-speaking people are more likely to be identified. They're more likely to be assessed for and to receive the diagnosis of ADHD and to get the proper treatment. So then that leads to this perception, a perception that ADHD is kind of like a white person diagnosis, because they're more, you see a lot of them getting the diagnosis, all the representation, when you look up information on ADHD, the pictures tend to be pictures of white kids. But we actually have it too. The problem is that it's not being accurately diagnosed, is not being accurately identified at the same rate in the Black community. So then the situation we have is that when they're assessing a Black child who presents with ADHD symptoms, they're not getting the diagnosis of ADHD. So what diagnosis are they getting? Well, I'll come back to that later. And when ADHD is accurately diagnosed in our community, so sometimes you finally get the right diagnosis, ADHD, guess what? There are still systemic issues with us getting equal access to quality treatment, right? So in the Black community, there are systemic issues with getting access to specialists like child psychiatrists or like child psychologists. So of course, a child psychiatrist is going to be the one who does the assessment and prescribes the medication. The child psychologist is going to be the person who would work with your child on skill building, teaching them how to do problem solving, teaching them how to be more organized. In our community, there is a problem with having access to these specialists. So you're more likely to have a community health center where you have a primary care doctor, but then when you need a specialist, you're going to have to drive some far away. In fact, I was reading last year that a lot of times the specialists, they are not even in areas where public transportation is available sometimes. So it's kind of like what ends up happening is it kind of starts to whittle away who has access. So if you're not available by public transportation, then that kind of whittles away people who use public transportation, for example. So there's not equal access to specialists, and that can then prevent your child from getting quality treatment. And so for me, as someone, I'm a specialist and I'm a Black physician, I end up kind of being pulled in every different direction because there's not very many people like me. And I have colleagues and they have the exact same situation, that they're just kind of pulled in every different direction because they are one of the few Black psychiatrists in our area. And so then what ends up happening is like I have no room to see any additional patients for the foreseeable future. But in any case, I for ADHD, I sometimes do run into parents who feel like their child is being labeled and being given this diagnosis of ADHD, but ADHD is actually more likely to be underdiagnosed in our community. So how can you tell if your child has ADHD? I'm going to break this down a little bit more. I mentioned a little bit about the younger kids in the classroom. And of course, inattention is a core feature. Sometimes what you'll find is that your child is hearing but not listening, right? They're hearing but they're not listening. So at school, they're missing information in the classroom. And at home, you give them an instruction and they don't follow it, right? And you think they're just kind of deliberately not following the instruction, but really they just weren't listening. So you might, you have to ask them to repeat back what you said. And you'll find out that they really didn't hear you. When you say, can you tell me back what I said to you? You'll hear them say, I didn't really hear you. And that's one of the ways that you know that they were hearing, but they were not listening. Kids with ADHD tend to do that at a higher rate. Children in general do that, but children with ADHD tend to do that at a higher rate. It's like their brain is just not paying attention. Okay. The other way that inattention shows up, teenagers, that might seem to need a lot more time to complete their homework compared to their peers. So you'll find that they are, their peers might say, yeah, I'm done with my homework in 2 hours, but your child is taking 4 hours to do the same amount of homework. And again, it's not having anything to do with their intelligence. It's just that they're getting distracted. They can't focus. They're reading the same paragraph over and over. They'll say they feel like something is wrong with their brain. They just kind of lose focus. They get distracted by other things. And what ends up happening too is that their brain needs a lot of stimulation to stay focused, right? So their brain needs a lot of stimulation to stay focused. So, a lot of times parents will say to me, they can do video games, but they can't do their homework. And the reason is video games are very stimulating. They're going to really light up the brain. So kids that have ADHD will actually be drawn to video games because it makes them feel something. It actually makes their brain alert. But if they have to do something less stimulating like homework, they are going to be forgetful and they're going to put it off. They're going to find it to be so boring and understimulating. So they put it off and then put it off and put it off. And then when they finally, at the end of the night, trying to rush through all the homework that they should have done earlier. So that's something that you see very often is procrastination. Kids put it off, it's too boring, I don't want to do it, I don't feel like doing it. And then at the end of the night, when it's bedtime, they're trying to rush to do, 3 hours worth of homework in 30 minutes. And of course they can't do that. And with adults, so adults with ADHD, it's going to look a little bit different because they're not in school. So what I often see with adults with ADHD, I see this sometimes with parents, the parents of the kids that have ADHD, a lot of times the parents also have ADHD too, that's sometimes undiagnosed. But they often have absent-mindedness, they're forgetful, they're disorganized, they lose track of time, they'll miss appointments. So you'll find like you get a call, you had an appointment today. Oh, I didn't realize, I didn't write it down. There's like a disorganization. Sometimes they show up on the wrong day for something. And you think, oh, you don't have an appointment today. And they're like, oh, I thought I did. Nope, not today, it's tomorrow. So that's often one of the things that I look for is that disorganization, the forgetfulness, showing up on the wrong day. Sometimes they rely on other people to keep them organized. So they might rely on a spouse to be the one that like holds the organization in the family. Sometimes I see it in teenagers too. Teenagers relying on their peers to keep them organized or relying on teachers to keep them organized. They can't keep track of their own school schedule. So what happens is that you might even be lecturing them about work ethic and nothing changes. It doesn't matter how much you lecture them because it's ADHD. It's something that maybe needs to be treated. And they may need a specialist to help them to learn to work on their system of organization. There are actually people that are called executive functioning coaches. I realized, began to realize in the last 5 years or so that there are a group of people called executive functioning coaches. They're not therapists, they're not psychiatrists, they're not physicians. Their sole purpose is to help your child with things like organization, planning, staying on track. Basically, all of these things that ADHD affects, their job is to help with that. Now, I don't think they're covered by insurance. I think they're out of pocket, so it's an optional thing. But executive functioning coaches can sometimes help kids with these nitty-gritty things that, like, if you know that your kid is smart enough to do the thing, but they're just having a hard time staying on track, sometimes an executive functioning coach is what you need. There's companies that do that, so you can even just Google that. And it's important, guys, because these kids, they begin to lose confidence in themselves. They realize they know that they can do it. They know they can do it. And so it's so frustrating to them that they're not achieving what they want to achieve. So the next thing is impulses. Okay. Hyperactivity. This is basically the ability to stop yourself when your brain tells you to do something. Kids have with ADHD have kind of struggle with this. So these are children, you tell them to stop doing something and they keep doing it. That is an impulse control problem. They can't pull it back. They can't stop themselves. Okay. And now some children, to some degree, all children do this. They're being annoying. You tell them to stop, they keep doing it. Because again, naturally, children will have some impulse control problems. But children with ADHD will have it even at older ages. So they'll keep doing it. They'll keep doing things that the idea just comes into their mind and they just do it right away and they can't stop themselves. That's an impulse control problem. Boys tend to struggle with this a little bit more than girls. Because they're just naturally more active at younger ages. And so again, impulse control will look like children, they're standing up when they should be sitting. When they're sitting, they can't sit still. They're squirming in their chair. They're talking when they're supposed to be quiet. They sometimes don't realize how loudly they're talking. They think they're whispering, but they're actually talking really loudly. They're interrupting other people. They're blurting out answers in class. They're making bad decisions without thinking through the consequences of those decisions. They may even make the same bad decision multiple times. Like they're trying to sneak and play a video game and then they get upset every single time they get in trouble for it as though it never happened before. Like, how many times do we have to say the same thing to you, And then sometimes even your friends and neighbors might notice that your kid stands out from the other kids in terms of their energy level. And so they comment on it. So I would even say that kids with ADHD, sometimes they themselves have difficulty making friends with other kids. And the reason is that imagine trying to make friends. If you're a kid and you're trying to make friends with another kid and that kid is interrupting you when you talk and they can't wait their turn when you're playing a game with them and they just are loud and they can be overwhelming. So sometimes even their peers don't want to spend time with them and they can feel quite alone. They can feel kind of alienated. So it can even be a little bit heartbreaking, to be honest, because you want your child to have friends and you see them struggling. You see them struggling to make friends. You see them struggling to do well in school, and it could be ADHD. So guys, if you have questions about ADHD, give me a call at 617-238-7111. That's 617-238-7111. Also drop a comment on Facebook at heat981fm.com. I'm Dr. Carryann Williams. This is Black Mental Health Matters, and today I'm talking about ADHD in children. So earlier on, I said this. I said ADHD is underdiagnosed in the Black community. They see our kids. Our kids come with symptoms of ADHD, but they're not leaving with a diagnosis of ADHD. So what are they getting diagnosed with instead? Well, when our kids show up with hyperactivity or problematic behavior, they're often seen just as behavior kids. They know that people don't always think through, like, I wonder what's underlying this scientifically or biologically. There's kind of this feeling that, like, well, this is just an intrinsic quality. This is just who these kids are. They're just behavior kids. They're bad behaving kids that need to be disciplined. There's not this curiosity. I wonder if there's a mental health diagnosis that's underlying this. And I wonder if, and ADHD is very, very treatable. It's very treatable. In fact, it's one of the few diagnoses that we treat that's actually very responsive to medications when it's a true diagnosis. But if you're labeled as just a bad behaving child, that's a character trait, right? That's not a diagnosis, that's a character trait. And that's a judgment on who you are as a person or who your child is as a person. And that's not a biological issue. And remember, I spoke about the school to prison pipeline, right? When our children in our community act up, they're more likely to come into contact with the justice system because their energy is perceived as more threatening. And that's one of the reasons I wanted to talk a little bit about ADHD today in our community, is that, as I said, the science shows that our kids they're presenting with the symptoms of ADHD at the same rates as white kids, but they're not always getting the diagnosis. But what we do know is that if there's 3 kids in a corner that are disruptive and 2 of them are white and 1 is Black, the Black kid is the one that's more likely to be noticed in that group of energetic kids, right? So our kids get labeled oppositional. They get labeled with all kinds of things. Now sometimes it's a correct diagnosis or whatnot. Sometimes it's not ADHD. But the fact that we're being underdiagnosed for ADHD means we're receiving some other erroneous diagnosis. And based on my work, what I've seen is there's often some other kind of behavior diagnosis that kind of gets put in there. As I was kind of thinking about this topic, I thought, I work at a residential program, and I've sometimes, over the years, that is, I'll see like a white teenager, maybe they come in and they have a history of aggression, but their diagnosis is listed as anxiety. So the reason they're admitted to the residential program is that they have some severe aggression, but they come in with a referral diagnosis of anxiety. And then a Black child would also come in with severe aggression, but their diagnosis isn't anxiety. It's something like oppositional defiant disorder or conduct disorder. Conduct disorder is a diagnosis that has more like legal implications. It's like, so I find it interesting, just my own personal observations on the fact that sometimes when I see white kids coming in with behavioral problems, people are more likely to be more curious about the underlying things and diagnose them with things like anxiety and depression. Whereas our Black kids, when they come in with behavioral problems, they're just labeled as a behavioral problem. They're oppositional. You have a conduct disorder, right? So thank you to those that are joining me on Facebook. The school to prison pipeline is real, guys. And I think that what ends up happening is people get so distracted by behaviors when it's a Black child, and we are seen as a bit more threatening, more dangerous. People feel like if the Black child is acting up, they're perceived to be more threatening. And so people are distracted by the outward behavior, and they start to kind of deal with the outward behavior and consequence the outward behavior. And there is less curiosity about, let's kind of talk about what's going on underneath this and not get so distracted by the surface things. So as I mentioned, then in regular public schools, the Black and brown children who are labeled as problem kids are more likely to be suspended. They're more likely to be expelled. And then, of course, Black and brown children who are suspended and expelled are more likely to end up coming into contact with the legal system. And then the cycle continues, where we have prisons that are filled with Black people with untreated mental health problems. So this is particularly relevant to us. It's particularly relevant to have proper assessments, have proper diagnoses, and also to really investigate that these diagnoses are real. ADHD is a real diagnosis. There are real treatments out there. Do your reading, do your homework, and make sure your child is getting the interventions that they need so that they can get the best possible academic experience and social experience that they can have. So children with hyperactivity and impulsivity they're often scolded for being lazy and disorganized. They often end up suffering from self-esteem issues. They often end up feeling very ineffective, and they can bring those feelings with them even into adulthood, because it's kind of that starts when you're a child. You just feel like something's wrong with you, and you can take that with you into your adulthood and become kind of lack in confidence, or kind of always doubt yourself, or feel like you need to always prove yourself. And some kids actually start to give up. I've seen kids that just kind of start to give up. I've met with kids that the system labels them as delinquents, and when you talk to them, they embrace the label. They say, you know what, I've given up on myself too. They'll say, what's the point? They've given up on me, I give up on myself too. They kind of develop this identity then as, I am a delinquent. What are you going to do about it? They kind of just take it on because it's what's been put on them. They develop that self-hatred. And that can lead to depression and irritability. And when people are unhappy, then some of their actions come from a place of unhappiness, right? So they wonder for years, what's wrong with me? What's wrong with me? And then they eventually just come to the conclusion that maybe they are what's wrong, which is pretty sad. And so if these kids can get assessed and treated really early on, maybe we could avert some of these problems. So anyways, I keep saying that ADHD is treatable. So what is a treatment, right? What is a treatment? So a lot of you already know the number one treatment for ADHD is medication. It's a medication called a stimulant. And the most well-known stimulant is Adderall. A lot of people are familiar with the word Adderall. We don't always start with Adderall in children. We often start with a different stimulant. And the stimulant that we often start with goes by many names, but the most popular name for it is Ritalin. Then the same kind of base medication that is what Ritalin is called methylphenidate. It also goes by the name Concerta. It also goes by the name Metadate. And all these medications like Adderall, Ritalin, they tend to come in two different forms, a short-acting form and a long-acting form. And the short-acting form tends to last maybe 4 hours, and you often give a second dose, around lunchtime or so. And then the long-acting form will last throughout most of the school day. And what the stimulant basically does is it stimulates the part of the brain that is having the problem. Remember I said the brain kind of develops from back to front, and that front area, they call it the prefrontal cortex, or the PFC. That PFC is just a little bit under kind of developed, and it's a little bit kind of, basically when we look at the brain waves, of children that have ADHD, and we look at that part of the brain that's responsible for attention, it should have the alert type of brain waves. But instead of having the alert type of brain waves, that part of the brain responsible for attention is running on idle. Or it has the kind of drowsy waves, the kind of waves you have when somebody's starting to fall asleep. That part of the brain is either drowsy or on idle, so it's offline. And what the stimulant does is it kind of puts that part of the brain back in alert mode. So it's one of the most effective medications that we use in all of psychiatry. Kind of by putting that part of the brain back in alert mode, it helps with inattention greatly, and it can also just overall help with impulses and hyperactivity as well. Now, it doesn't last all day. It does wear off, sometime after school. And people can even skip giving the medications on the weekends. They can skip giving it on holidays. Again, with a physician's instruction, you can skip weekends and holidays, and you can choose to use it only on school days if you would like. But sometimes the difference with having and not having the medication is so dramatic that sometimes parents will choose to continue to give the medication even on the weekend, or sometimes even during holidays as well. Now, everything has side effects. So here are the side effects of the stimulants. They're wonderful medications, but there are side effects, okay? So stimulants like Adderall, they fall under this group called amphetamines, right? So amphetamines, they can slightly increase your heart rate. And that means of course your heart's just beating a little bit faster. It makes your blood pump a little bit faster. And in children, that's just such a mild effect. It's not anything dramatic. However, what that means is that your child needs to have a healthy heart. So if your child has any history of heart problems, what we ask is that you need to be cleared by a cardiologist. So you have to go to see a heart doctor. The heart doctor would just do an examination, and they will tell us whether or not your heart is healthy enough for us to prescribe the stimulant. So very simple thing. We do it all the time. If somebody has a history of a heart problem, or they have a family member, like a parent who has a history of a heart problem, we'll say, you know what, just go to the heart doctor, go to the cardiologist, get an assessment, and just make sure that your heart is healthy enough for a stimulant. So easy thing that we do all the time. So if there's no history of a heart problem, there's no reason to see a heart doctor, because it's such a mild kind of effect. The other very, very common thing, though, that we see with stimulants is that it can make kids feel less hungry. We call it an appetite suppressant. It suppresses the appetite. In fact, there are a lot of different supplements on the market that adults take to lose weight, and they also contain similar things like amphetamines in them. And that's why sometimes you hear these people talking about if they take more than the recommended amount of a diet supplement, they can end up with some kind of medical emergency, because sometimes people don't realize that diet supplements have amphetamines in them, because that's how they suppress your appetite. The difference that with these medications for kids, it's not some kind of sketchy medication you're buying off the internet to lose weight. This is actually medication that it's an established FDA medication. It's established, tested, and so it's something that has been the safety of it has been established, and it's very commonly used. So if you guys have any questions about medications, you can drop me a comment on Facebook Live on heat981fm.com. So basically what we say for the appetite suppression side effect is that you want to give them breakfast first, then give them the medication, And then they may not be too hungry at lunch, but then their appetite will return for dinner when the medication wears off, and they can actually have a bigger dinner, and that's okay. So as long as by the end of the day they're still having enough calories, and that's fine. Now, over a period of time of appetite suppression, it can affect growth. So that's why it's really helpful if you can give your child a break on the weekends, give them a break on holidays. That can give them a chance to kind of have their appetite back and to eat and to kind of grow and all that stuff. The other thing is sleep. That's kind of one of the last kind of important side effects, is that stimulants can affect sleep a little bit. And that's because even though the medication wears off after a period of time, sometimes there's just a tiny amount still left in the body. Even though it wears off, there's just enough left in the body that makes it hard for them to fall asleep. So those are kind of the most common. Oh, is there a phone call? Okay. Go ahead, caller. Oh, hi, Larry. How you doing? I agree with that. And thanks for bringing that up, Larry. I think it's important for parents to know that you can ask your provider to do a classroom assessment. So if you have a psychiatrist that's doing an assessment or a psychologist doing the assessment, you can say to the school, I would like for my psychologist or my psychiatrist to come in and observe them in the classroom and do an assessment. And that can provide a lot of clarity because, you can see for yourself how the child is behaving. You can see for yourself how the teacher responds to the child's behavior. And you see them in that natural environment. So it adds this extra layer to the assessment that it's helpful because now you're not just getting the information secondhand. You can see it for yourself. And then I've done the classroom observation before, and you can provide a written report to the school, because sometimes that's just times where I notice that the teacher isn't actually managing something well. And I can provide recommendations and say, here's what you should do in this situation. So thank you for mentioning that. Mm-hmm. Yeah, that's fine. Thank you. Yeah, so guys, you heard from Larry. It is important to not remove yourself from the equation just when your child gets started on a medication. That's not going to be the whole solution. So often you have to, in addition to the medication, also be very present, continue to assess, and to provide a lot of other kind of scaffolding. So the medication might help with attention, but maybe the child still needs, for example, an executive functioning coach, someone that's going to help them with organizing and problem solving. They might still need a therapist to do some skill building. And you might need to then be involved with that and work with them. Go to those appointments, do what we call like a dyadic, so that both you and the child in the therapeutic space kind of working together, and the therapist can teach you how to teach the child the skills. Do a lot of like parent coaching. That's going to be the key. Actually, kids with ADHD thrive with parental involvement with the treatment. So, and as Larry mentioned too, it's important to be very consistent, because if you're inconsistent with your, use of the treatments, and you're going to get inconsistent results. You're not going to get the best results at all. So here in these last few minutes, I want to talk about another kind of medication that we use to treat ADHD. And this one is not a stimulant. It is a different kind of medication from a stimulant. And it's a medication that's more for hyperactivity. It's not so much for the inattention. It's more for the impulse control. And one of them is called guanfacine. And it's also known as Tenix or Intunif. So some of you might have children that are on this medication, Tenix or Intunif or guanfacine. All three things are the same medication. And there's another one called clonidine that also goes by the name Capvade. Those medications, they're not stimulants, but they treat hyperactivity. And what it does is it kind of just helps to modulate that energy level. But the downside is that sometimes it can cause some tiredness. That's kind of the main side effect for that, is that it can cause some tiredness. So something like clonidine, sometimes you give it at nighttime to help the child settle. So after the ADHD medication, after the stimulant wears off, if your child is restless again in the evenings, sometimes we'll prescribe guanfacine or clonidine, and that will help with the evening restlessness. The other thing, so it can cause tiredness, but we also monitor because it can cause a little bit of a slightly low blood pressure. Again, not dramatic, but we usually will check blood pressure when we prescribe guanfacine or clonidine, just to make sure your child's blood pressure isn't already low. As you know, sometimes children can be very small, they have a slim build, so I always will check blood pressure just to make sure it's not too low before I prescribe with a guanfacine or clonidine. So I'll check for those things. And guanfacine and clonidine is useful for other things besides just ADHD. It's not just ADHD. It can be used for trauma. It can be used for anxiety. So your child may be on it and they may not have ADHD. It might just be used for other things. So it's important to know that. So guys, I just want to say, ADHD is one of the more straightforward things that we treat in psychiatry. It's one of the few things that tends to respond very well to medication. You'll know very quickly whether or not the medication is working. Most kids are going to be taking it very regularly. Some kids will only need to take it on school days. If they are taking the non-stimulant, the other one I mentioned, the guanfacine, they can't take breaks though. They can't really take the breaks on the weekends or the holidays. That one you do have to take every single day. I said, if you have any questions coming up here throughout the week about ADHD, about anything else, if there's any topics that you want me to talk about in the future, just DM me on Instagram at drkerryann. That's drkerryann. And you can go to my website, drkerryann.net, if you want to watch past shows or listen to past shows. So that's it for ADHD. And I hope you guys enjoyed listening. You've been listening to Black Mental Health Matters. I'm Dr. Carrie-Ann Williams, and I'll be back again next Sunday at 1 p.m. Eastern Standard Time here on the Urban Heat 98.1 FM. So I will talk with you next time. Bye. Hi, everyone. Thanks for listening into the show today. For more on Black mental health, you can go to my website, drkerryann.net. You can also DM me on Instagram, also Dr. Carrie-Ann. And you can leave a question for me that maybe you want me to answer on an upcoming show. You can also suggest a topic for a future show. And other than that, just keep listening in to Black Mental Health Matters every Sunday at 1 p.m. Eastern Standard Time at heat981fm.com. So I will see you next week.